Hello everyone, today I will talk about a case study. At the beginning, I will introduce this student and his family information and how he is performing in the school and the intervention to help him. And last one, thank you everyone to support and providing any suggestion to help him. Kevin is a 9-year-old boy and he is white and American. He studied in a Mandarin immersion program. His change is quiet and follow direction. The challenge for him is social interaction with peers and concentrating in class. Kevin is come from the middle class and both of his parents are working in the school. Her mother is a substitute teacher in our school and his father, I'm not really sure his position, but he is help cleaning and fixing something around the school. And Kevin didn't have any sibling. Kevin have anxiety disorder. Anxiety disorder is generalized worry, fear, and worriness that students express a lot of time. As we mentioned before, both of his parents are working the school, so he is cleanly around his parents. During every recess time, he always searching his father. If he didn't find his father, he would like to sit alone in the swing and pray by himself. If he saw his father, he just walked to his father and talked to him. Since last year, my mentor is pregnant, and his mother is so worried about him. So his mother gave up her job to be a substitute teacher in our school. Kevin also needs to take medicine for his anxiety. His concentration is automatically lost in the class because of the side effect of the medicine. He is quiet and not willing to express his feeling. From my observation, he is worried a lot that I could see from his facial expression. But he is not afraid to participate in the class, and when every time he has question, he always asks me or my mentor. I can see that he is afraid to missing anything that he needs to do in the class or in the school. Kevin is like to avoid some situation in the classroom. When teacher randomly choose student to answer a question, he would like to put his head down and avoid the eye contact. Since he is in Mandarin program, students in the classroom are required to speak Mandarin. But they can use the magic word that can I speak in English to help them express better in certain situations. Every time he raised his hand and tried to ask question from me, the first sentence he said is, can I speak in English? Based on his Mandarin level, there are so many questions that he could use Mandarin to ask, but he is afraid and not willing to challenge himself. There are some interventions that we try to help him and providing some special needs for him. The first one is 504 plan. 504 plan is a formal plan that school developed to give students with disability to support their needs. A set of accommodation or change in the classroom environment to help students allow the regular curriculum. There are 3 accommodations to support Calvin to study in the general education classroom. The first one is to allow use of small tactile coping object, such as squishy ball, smooth stone, small stuffed animal. But I never saw him use those things. My mentor said he did not need that anymore, and he told me that those did not work with him. And the second one is to allow him to talk Sorry. The second one is to allow him to take a walk around the quad at teacher direction. And the last one is allow him to visit school nurse. So the other strategy is don't avoiding things just because they make Kevin anxiety. Just like the situation I mentioned before, he asked me, "Can I speak in English?" I say yes in the first couple times. After I recognized his Mandarin level, he thought I would say yes at that time, but I didn't. I asked him, "Can you speak in Mandarin in a fun way?" He laughed and trying to challenge himself. And the next strategy is to express positive but realistic expectation. I always tell him that don't afraid to make mistake, because mistake prove that you are trying. You will never success after you trying one thing. And how can we help Kevin? Thank you so much.